Welcome, everybody, to our next installment of the Rubin Dream Job webinar series. My name is Danny Rubin. I'm the founder of our company, Rubin. We're based in Virginia Beach, Virginia. We help students with their business communication skills, their soft skills. And one way we do that is by interviewing professionals in in-demand fields to discuss what they do in their job and the importance of being a strong communicator in that job. And we have some excellent guests today: Sarah Jones, Scherry Clark, and Cindy Beck, who is here from HOSA, the Health Occupation Student Association, and she will explain shortly what that's all about. And so what we'll do today is we're going to hear a little bit about HOSA for those who are not familiar. By the way, do we have any HOSA chapters here represented in the chat? Tell us, any HOSA folks here today? Who's here from HOSA? It's a large group, so there may be somebody. And HOSA, there we go, boom. How about that, Cindy? They're all flying in the chat now. So we're gonna hear from Cindy, and we'll hear from our two guests, and then we're gonna do a Q&A. And then at the end of our time, around 35, 40 minutes from now, I'm gonna share with you a special tool that our company developed that teaches email etiquette. Teachers, any hands if you've received an email from a student that looks like a text message? Any hands, teachers? Have you ever seen an email like that from one of your students? So a special tool that any of the teachers and advisors have access to at the end of our session. I'll explain how you can have a special tool for Gmail and Outlook that'll help students write more professionally. That'll be at the end. So hang around till the very end for that opportunity. All right, so let's get started. And let me first bring in Cindy Beck from HOSA. Thank you, Cindy, for being here today. Tell us, what is HOSA and what does it do, and how could teachers and students who are interested get involved?
Thank you very much, Mr. Rubin. I am Cindy Beck. I am the board chair, and it is my honor to represent HOSA with you here today. But I wanted to take a moment just to say something about dental assisting. That is my background. And I will tell you, as a young individual going through finding out where I wanted to go in life, I absolutely loved being a dental assistant. It was a part of my life. I loved it. Every minute I was in a dental office, I absolutely just loved being there. Everything about it. Sounds funny, but I absolutely love teeth. I love to see teeth. I like to see everything about it. So for me, it was a launching board. I went from dental assisting into various things, but I ended up being a dental assisting instructor. And then from there moved to supervising at a state level and now at HOSA. So HOSA, Future Health Professionals, is a student-led leadership group. We have 49 states, 7 countries and territories that are members of HOSA. We have about 300,000 members, and those members are actively involved in HOSA. HOSA is a part of the classroom. It is not a club that is only after school, that you do things on the weekends. It is an integral part of your curriculum. It is brought into the classroom where students have the opportunity to learn about the various careers, dental included. And you know, there's a lot of different levels in dental that you can be involved in. And HOSA is a great way to experience some of that so that you can make a decision as you move forward in your careers. Dental assisting is one of those competitive events. HOSA has a number of things that we do, but the competitive events is quite popular with the students. You know, students love to be competitive. We have 96 competitive events that within the classroom, the teacher can use those rubrics, can evaluate the students. They have the opportunity for exploration. But at the end of the day, there is usually a state competition. It is called a state leadership conference. And then we move on to an international leadership conference, which brings in about 12 to 13,000 students. Wow. We will be in Nashville next year. Everybody wants to know about how you get involved in HOSA. Because it is part of a CTE program, most of the things that HOSA embodies, such as learning leadership skills. Your soft skills are very, very important. Learning communication, teamwork, learning how to individually work on projects. We are a service organization. HOSA provides incentives for service. We're going out into your community providing service. We have some projects. We have blood drives. We have bone marrow is one of our service projects. And so students within the classroom are learning these kinds of leadership skills as well as a variety of soft skills. And then in many of our classrooms, our CTE classrooms, and I hear there's a lot of dental assisting programs out here, yay, you're learning the skills. Those skills are a part of our competitive events program. And so just a little bit to wrap up with HOSA, and I'm sure I'll have an opportunity to answer more questions. Yeah. We are 100% health care. We are the premier and leading organization for healthcare. Our mission is to empower students to become quality individuals working in the global healthcare community. We provide opportunities. We have a lot of resources for teachers. And all in all, it is probably one of the most influential experiences and lifelong learning that you will ever have in your career. And if you ever have questions, like I say, we'll put my email up and you can email me, teachers especially, if you want to learn more about it. But it is an absolute wonderful program for students wanting to go into any kind of healthcare. And like I said, dental assisting is a part of that. And you would, and you know what? It's really fun. So with that, I'll let you go and turn it back over to you, Mr. Rubin.
Thank you so much, Cindy. And like I said, please, stay close. We're going to include you in our conversation as well. All right, now let me turn to our special guest today. Let me first start with Miss Scherry Clark. Scherry, can you say hello and tell the group what you do every day as it relates to dental assisting?
Hello, everybody. My name is Scherry Clark. I am located here at the Foley Center in Virginia Beach, Virginia. I serve in two capacities here at the Foley Center. One, I serve as a intake, seeing new patients and post-op on the surgery hall, working with Dr. Folick. And I also work in orthodontics, working with Dr. John Quadalak 3 days a week. I also serve as a dental assistant instructor here at Dental Careers Foundation, which is owned by Dr. John Quadalak. So I also teach students and train them also on the clinical floor.
Wonderful. Thank you so much. And Sarah, let me turn to you and tell us about your job.
Hey, I'm Sarah. I work at Full Implant Choice in Virginia Beach. We do what's commonly called the AOX surgery. I started my journey back in 2013 in oral surgery. I love this field and being an important role in changing someone's life. There's so many options with dental assisting, whether it's, pediatrics, surgery, orthodontics, and it's a lot of fun.
Awesome. Thank you both so much. Let's start. Scherry, take us through your day. What does it look like kind of throughout the morning and the afternoon? And as she answers, I want to now encourage the teachers and students to go to the Q&A along the bottom of Zoom and type in your questions. Please put your name and your school so we can give you proper credit. But start putting your questions in Q&A and we'll look through those. But Scherry, go tell us about your day.
Okay, our day starts out with a morning meeting. We review the schedule. We talk about things that we can improve throughout the day or special things that we need to pay attention to with our patient load or staff members. Upon starting our day, we'll go ahead and set up, make sure that our rooms are usually preset before the previous day. We'll bring our patients back and we go interact with our patients, making sure that we have all of their medical updates done, reviewing any procedures that we may have with that patient that day, finding out just how their day is going so far, just breaking the ice, getting them acclimated to what they're going to experience for the day. Answer any questions that they may have. If it's a child, we kind of introduce them to the room, introduce them to some of the instrumentation or materials that we may be using so they're not so fearful. So I see my patient, we go through the procedure. When it runs smoothly, we give post-operative instructions, and that's just throughout the day. But for the most part, we have fun with our team members. We try to help out if we see that there is a need in the schedule. Yep,
Thank
we
you.
go through the
That's
schedule.
great. That's a great start. And Sarah, tell us about your day. Scherry is doing general dentistry. You're doing implants. So how does that differ? How does the implant side differ as a patient sort of walks in your office?
Yeah, so for me, we come in for the day, we set up for surgery, we'll bring the patient back, get them comfortable, make sure, they have everything they need. We assist, the anesthesiologist in, helping put them to sleep. We assist the doctor in surgery. And then, once the patient wakes up, we do all of our sterilization and getting ready for the next day. Going over post-op instructions with their caregivers. And that's pretty much what, each day looks like for us.
When we say implant, can you give an example? What does that mean? Someone's getting a dental implant. What's an example of that?
Yeah, so, if they have a tooth that, was removed and they want to replace it, whether it's, for cosmetic reasons, we would put in the implant. Here we do, the what's commonly called the AOX surgery. So most of the time they are getting upper and lower teeth completely replaced.
You said it's called an AOX.
That's, yeah, typically what it's called.
Okay, like the letters A, O, and X.
Mm-hmm.
And I want to explain students what I'm doing, and we tried to do in all of our interviews, is I'm asking follow-up questions. If there's something I want to learn more about or need clarification, I ask for more information. Sarah, is it okay if I asked you about something that you said so I can learn more about it? Like if I was shadowing you, would you want me to ask follow-up questions or just stand against the
Sure,
wall,
absolutely.
right? You want to know that I'm like listening, sort of leaning in. Okay,
Great.
we have a lot of questions already that filled up in the Q&A, and one of those questions, I forget who said it. Let me find it again. Well, I'll find the name in a second, but the question was the sort of educational path that you took to get to your job. Let me start with Scherry, and I'll have Cindy weigh in too. Scherry, tell us the education and training that was required for you to do the job that you do today.
Okay, first I have I applied at a local dental assisting school. This was about 30 years ago. I went through that program, which was about 18 months long. It included externship sites at the military bases. So I've been to most of the military bases in the Virginia area.
Hmm.
Once successfully completed, I earned my certificate of dental assisting. I took my X-ray certification exam. Back in those days, we had to be certified to place topical and fluoride, so I had those too. We took our state boards, have my registered dental assistant license there. Does require CE courses. Took parts of the Danby exam, radiation certificate with the Danby.
Okay.
A special training with orthodontics through Dr. John Quadalak's office about 20 years ago. That's my background.
And Cindy, tell us about your training when you went through it and how has it changed up through today?
Yes, I actually started working in a dental office when I was in high school. I absolutely fell in love with it. And from that point on, went through a training program. And in California, we have a multiple levels of certification that you can get as well, and received all of those certifications or registrations and extended functions. But at the same time, I worked my way through a university as a dental assistant, and I became a health education instructor, teacher, and decided once I got out of school that I would go back and get my CTE dental assisting certification so that I could teach. And I did teach for about 15 years. And like I said, I think it's was a wonderful background because I was then able to move to a state level, and I was the health science state supervisor for all of California. And from that point, I did a variety of things. And as a state supervisor in California, I was the HOSA state advisor for 17 years. And now, again, because of my background in health science, because of my work with HOSA, I have the pleasure of serving as the HOSA board chair.
Thank you. It looks like Sarah dropped off, but now she's back. While she gets that up again, I have a good question here. I'll ask Sherry. This is from Gabriella Troches from Discovery High School. What is the difference between a dental hygienist and a dental assistant?
Okay, these are two separate dental professions. Dental assistant, we are the right hand to the dentist, so to speak. We serve almost like an RN in a healthcare setting, but in a dental setting. So any procedures that our doctor offers us care, we are right there working alongside him through patient care.
Okay.
The dental hygienist is a profession all within her own. They are keep up the hygiene, maintenance of people's teeth, patients' teeth, and keeping up their oral care. They can scale, they can do dental anesthesia, whereas dental assistants cannot. They can diagnose cavities, they can diagnose gum disease. They can probe, they can write prescriptions. So their job is a lot different than a dental assistant.
Okay. Thank you for that distinction. And Sarah, if I can hear you, can you put your mic back on and see if you got audio again? A question here from Patricio Herrera Lopez, Taft Union High School. What are some of the challenges of being a dental assistant? Like, what are some of the tougher parts of your day where you really have to focus hard? What would you say to that? Here, turn on your mic. Try to turn on your microphone. If you can, I'll ask it to the other guests, but your mic is muted right now. Okay, well, let me ask Sherry that question first. What are some of the challenges in your day? Now, you're on the training side, you've been on the patient side. Like, what are some of the things that are more challenging about the job?
Making sure that you're running on time. And the schedule can be a little bit challenging, making sure that you're staying on target with your patients, making sure that the procedures are running efficiently, making sure that you have everything that you need to work through the procedure, making sure that your patients have a positive experience, making sure that your doctor have what they need when they sit down to do the processes.
What would you say to that, Cindy? What are some of the tougher aspects of working in the field?
You know, I don't know if it's one of the toughest aspects, but for me, it was very important. I too have a background in oral surgery. And one of the things that I think is very important, and it can be very challenging, is that you have to be very observant of the patients because they do come in with a variety of issues. They come in with a variety of health issues, not only just dental. And all of those dental is a holistic type of thing, and it is part of the whole entire body. And so you holistically have to make sure you evaluate and look at their health history, their medical history, and make sure that you are observing their behaviors. And again, what Sherry said, making sure that they have a very positive experience because it is an important experience for them in their life. But I think just making sure you're always watching, making sure that they are in a good space. They are you're paying attention to any of their health needs.
Well, that gets us into the conversation about sort of patient engagement and professionalism. By the way, Sarah, is your audio working? Can you hit the, you're muted. So I need you, let me see if I can unmute you. See if you can turn your audio back on. But let's talk about that side of things. Let's start with Sherry. On the professionalism side, where do those professional skills play out in your day? When you're greeting patients, when you're explaining things to them, when you're writing up reports and being accurate with your writing, like how do those professional skills play out in your day?
All day, all day. Yes,
So?
and with every aspect. Down to seating the patient, down to explaining what's going to happen to them, recording what the patient is speaking back to me and being able to communicate effectively to the doctor what those concerns are. So listening skills, gathering data, making sure that each thing is documented and the patient's history is you're just constantly taking in information. Now, as far as being professional on your job, this is a people's healthcare. We're part of that. We're taking care of our community members. And we want to always be able to walk in this profession and take people seriously, take their health seriously, but in a very relaxing setting. So we try to create the atmosphere for the patient that they can be on the sharing side of whatever their needs are and being able
Right.
to
They
address
want to
that.
feel comfortable talking to you because, they may have just
Right.
met you 5 minutes ago,
That's
but they
right.
have to feel comfortable talking to you and sharing health information. So you
Very
have to
true.
create that space. Cindy, when you were working in the role, how did you create that welcoming space?
Well, I think one of the things that is important, and again, making sure that you know who that patient is as they come in, and being there to answer their questions, because many times they're apprehensive. Sometimes they'll tell you, "I'm scared to death," and I think they don't have an understanding of what's going to happen, and perhaps someone has told them a story that they didn't have a good experience. So as Scherry mentioned, it's very important that you make that patient feel comfortable and listening to them and hearing what they're saying, and realizing that sometimes from their point of view and your point of view, it's different. So your uh, part of your job is making sure they understand. And so you are educating them. They don't understand all of the aspects that you do as far as their dental health is concerned. So you have the opportunity to be an educator to those people. And as you do that, they start to feel more comfortable and always treating them professionally.
And Sherry, and by the way, Sarah, if you're able to, I'd love for you to answer these questions, but your mic is still on mute. But Sherry, how do listening skills play a factor in your day when you're with patients? How do you really focus and hear them so you can do what I was discussing earlier, which is asking follow-up questions? How do you use your listening skills?
Well, the way that I use my listening skills is, number one, I want to establish face-to-face and eye contact with the patient. And I'm always
Mm,
interested, appearing very interested in what they're about to tell me. If just say, for instance, we're reviewing a medical history, um, it is just not enough on the sheet, on the medical history. We need to review every single aspect, maybe expound on some of the questions or some of the conditions that they may have, maybe expound on some of the doctors that they see. Let's get some phone numbers. Let's see what this doctor prescribes. So details matter,
mm.
um, and gathering any type of information and being able to hear and listen for certain things that your patient is expressing to you. So if it's anything like fears or anything specifically about their health that they're telling me, but they may not be sure. So I may document some things and maybe go back and do some research about that so that I have my records clear. As far as the patient, I really want them to know that they can talk to me. So I kind of really push for that nice, good patient rapport. I may say something, if I said that they're apprehensive, I may say something funny or may touch their hand and just try to make sure that my tone comes across very friendly and inviting.
That,
So it
these are
takes down their
great answers.
inhibition,
Well, I
takes down
think it's
their
really important
inhibition so they
students
can share
know
with me.
it's about the training and the in
Mhm.
dental assisting, and it's about all those people skills too. And you have to use them both at the same time all day. One more question on the professional side. Cindy, when you were working, how did writing skills play a factor in your job? Were you writing at all?
Absolutely. Now there's a variety of ways that charting takes place, but anything that you write about that patient is a patient record, and it's extremely important. You do not want to record something about uh, tooth number 12 when it should have been tooth number 13. I mean, there's always the comparison of making sure that everything you put down is absolutely accurate.
Hmm.
And going back a little bit to communication, part of that is making sure that as a part and an integral part of the dental team, that everyone is communicating together and that everybody has the accurate information about that patient. So when the procedures begin or their appointment begins, you do have everything you need, and the patient is comfortable, and the patient is secure, and they have confidence in the work that you do. But accuracy of any kind of recorded record is absolutely important. And so the communication, whether it be verbal, nonverbal, or in writing, is an absolute must in a dental office.
So you're saying that you can't use like texting lingo in dental records. You have to use full words and punctuation. Am I
Well,
hearing that
dental
right, Cindy?
offices have their own language.
Well, that's true too.
Dental
But
offices have their own
abbreviation on dental
language.
terms,
So
right?
you need to know terminology and use the appropriate. Yes.
Yes, I
Yes.
understood that. Question here from Amanda Nelson from Waupaca, Wisconsin, if I pronounced that right. I'll ask Sherry, what are the physical demands of the job? Are you standing for long hours? Does it hurt your back? What is like the physical side of working as a dental assistant?
Well, we are on our feet quite a bit throughout the day. We are setting up rooms. We're bringing instruments and materials back and forth to sterilization to our rooms, setting up, breaking down, walking out to the reception area, walking our patients back to the room. But during the procedures itself, we do have ergonomically correct chairs. Okay, so that's one part where we do get to sit and do our procedures. But yeah, we're on our feet. So it's pretty physically demanding. We are physically doing the work, opening up the drawers, setting up the rooms, bibbing up the patient, taking blood pressures, and especially if you're in a surgery room, if you're in a surgery team there, you have some of the larger setups, some of the bigger pieces of equipment to maintain, to maintenance. But I would say it's good exercise. It's good exercise.
Do you track your steps?
I don't, I used to, but I don't anymore.
Probably a lot of steps, just pinging around the office all day, back and forth, in this room,
Yeah,
out of
you're on
that
your
room.
feet.
Question, I'll ask both of you this question. I think Sarah Jones is still having some technical problems. Hopefully she'll join us again. Emily Benitez from Southwest Miami Senior High School. Welcome, Miami-Dade, and all the students here from Miami-Dade. Well, what inspired you to follow this path? I'll start with Sherry. Like, you've done it for 30 years. So what
Yeah.
made you want to go into this career to begin with?
Oh my goodness. Well, I was a
Think
pre-law
back,
major in college.
pre-law.
I was in pre-law, and dental assisting tech school was a summer program that I started, and I didn't finish for 18 months. And I just fell in love with the field. I fell in love with my instructors. The course that I had went through was very detailed. And I found that I was really good at it. I was really good at it. What I did enjoy the most while I was in dental school was the lab aspect because it allowed me to use my artistic ability and creating dentures and teeth and crowns and making gold crowns and doing the elaborate lab work there. So it allowed me to use some of my artistic skills. And after a year and a half, I was able to join on to the military basis. Me and my best friend had came through the program, and we actually got the contract for our school at
Hmm.
Langley Air Force Base. And we went and sat with the chiefs and the captains, and they were very impressed with us. So from our meeting with them, we were able to establish a contract with the school, which all of the students after us had access to that base
Wow, that's a great story.
for training.
I love
Yeah.
that. Here,
Mhm.
Cindy, I'll ask you a different question because it's a HOSA related question. Although this is from Taft Union High School in California. If schools, let's say they don't have HOSA right now, of course, we'd love them to start a chapter, but if they don't, what are some other ways students can get involved? Is it appropriate to shadow a dental assistant during the summer or the school year, or even when they're in HOSA? How can they get that real world experience at a dental practice?
So that's an interesting question. There's a couple of ways. Of course, the best way is to be in a program at your high school or something like that, so that you will, most of our CTE programs do require that you have job shadowing as well as work-based learning. And so you are on site and you are learning. If your school does not have that, a lot of dental offices are open to having you come in and observe and see if it's a career, because we know that across the nation, at least I can speak to California, there is a severe shortage of dental assistants. And so we are trying to get people interested in the career. And like I say, I love it. I have always loved it. And if you could just, maybe the local dentist that you go to, just tell them, could I come in and job shadow for a day? The other thing is that in many areas, you can get work experience and go to that dental office and maybe do afternoon work or something. It depends on what part of the country that you're in, but they will start allowing you to come in and do some simple tasks and then move from simple to more complex and get you very excited about it. And then you can pursue your career.
And I want to ask a follow-up question about that, Cindy, and Scherry can answer too. You say, reach out to your local dental practice or reach out to your dentist, but the reaching out, that's really the critical part. Should they pick up the phone and call and introduce themselves? Should they walk in with a resume or a list of classes they've taken? Or what is the most professional way for the student to ask about coming in? I'll start with Cindy, then I'll go to Scherry. What would you want to see from the student?
I'm a little old school, but I think that a student dressing up professionally, bringing in some kind of information, knocking on the door and walking in and say, I'm really interested in a dental career. It's not offered at my high school. Do you have any opportunities for me to do any job shadowing or, take a look around and maybe spend a couple of hours and see, in your office and see what they say to that. That would be the way that I would think would be.
I love that.
And remember, your communication skills are very important. Your first impression is very important as you walk in there. So the way you look, the way you conduct yourself, the way you act is very important about you being able to get in there. Now, if you are a patient of that doctor, maybe perhaps at your next appointment, you could mention that.
Thank you. I want to say this question came from Shannon McKee at the Dentist Technical Education Center Dental Assisting Program in Boise, Idaho. And let me ask that to you, Scherry. What do you want to see from a student if they walk in or they contact your office and they want to shadow? What do you want to see from them to feel like they're serious about it?
Enthusiasm and interest.
Tell me more about that. What does that look like to you, enthusiasm? How do you feel that?
Yes, I like for them to come with a smile on their face. I want to see that dentistry brings them joy, that they have done some research about the field, and it makes them excited to even be in the atmosphere. So I'm looking for a smile on their face. I'm listening for enthusiasm in their tone of their voice, and then the words that they select to speak with me. If they're serious about coming in to shadow, I'm always looking for good people to join the profession. Always. And like Cindy said, we do have some shortages. And since 2020 and the pandemic, we are slowly filling those shortages. But we do need interested people to join the team. And we are wide open, looking for it every day.
I want to take a quick pause from the conversation. Everybody stay here. And I want to share the resource, which can go right into our conversation. How do you reach out to a dental practice? Let's help students write more professionally so they're taken seriously by Cindy, Scherry, Sarah, and others inside the industry. So I'm going to share my screen and I'm going to demonstrate a resource for the students and teachers. And this opportunity is for the teachers here and the advisors. The tool we developed is called Propel, and it is an email etiquette teaching tool. Can you in the chat, please, everybody? Tell me in the chat, is your school using Gmail or Outlook? Gmail or Outlook? Tell us in the chat. Gmail or Outlook. All right, this is for both. And I want you to watch this closely. And the teachers who are here, I'm going to give you a chance to have this tool at no cost to you right when we're done watching this video. So watch this with me. It's called Propel. Let me show you our new Propel email etiquette tool. When we hit compose, we're shown a pop-up form which guides the student to fill in all the important sections of the email from the subject line to the conclusion with a read aloud function in every step. And for schools that use Outlook, we have Propel there too. We need a subject line. The student wrote question lowercase q. We then need to address the person formally, but we're just going to write hi teacher. Student wrote good morning with a lowercase g and a sentence with no period. What's the purpose of the message? I have a question about my geometry assignment. I'm stuck on problem 3. I can't find the answer. 3 question marks. Not great. The conclusion, it's not formal. THX. Then we hit review my email. The words are formatted in the email. Check out the right side. We have light bulbs with more suggestions. By the subject line, your subject line is too short. Capitalize the first word in proper nouns. So we want the student to come over and change the subject line. Address the teacher with a formal title. I'm Miss Smith. Capitalize the first word of a sentence. We want the student to come over, capitalize. Well, what about the end of the sentence? We're missing a period. Place the period. What about these 3 question marks? That could be unprofessional. Remove 2 of them. And finally, the THX, also not professional. Write out the word thanks. Propel teaches a student how to write an email, and the student does all the work. All right. Let me come out of here. And let me just ask in the chat, do the students or teachers, would you find that tool useful if you had that in your email to help you? All right. See a lot of yeses. So here's what the offer, and we'll do this quickly and get back to the conversation. If you would like, teachers only, please, teachers only. If you would like this tool in your classroom, I'm going to give you a link to our Calendly, and you're going to choose a time over the next week for about 10 minutes, meet with our team, and we'll give you this tool for your class at no cost. So you can be one of the first teachers in the country to use it in your program. All right. So that's all you've got to do. I'm going to put it right now in the chat. Leave that up, please. And I'll put the link again in a second because it's going to fly by probably, but please go there right now. Teachers, this is an opportunity while you're in with us live in this webinar. Please grab this link, request the tool, and help your students write professionally to folks like Sherry, Sarah, Cindy, and every other dentist in your community so that you can make a great, as Cindy said, right, a great first impression. Cindy, what do you think about what I just showed? Since you said making a first impression is critical.
I think it's very important that any kind of speech or written communication is done accurately and professionally, because again, you want to put your best foot forward, and it goes along with applying for jobs as well. You want to make sure that you're the one who stands out and you have done everything at a professional level, because remember, you're going for a professional job. And so that is very important.
Thank you. Sherry, your thoughts on like writing a message to you that would look good versus something that looks like a text. And if you saw something from a student that's all sort of text lingo versus a professional message, which one are you more likely to answer?
Definitely the professional message.
Why is
I'm
that?
kind of an old school gal. I
Old
don't do
school
a lot of
gal?
text messaging, so I don't know. I don't understand the lingo myself. So I'm always looking for something that's going to come across very professional.
Great. Getting back to just to take a few more questions from our chat, and we'll start to wrap up. Sarah Rowe, Arrowhead High School. You mentioned, Sherry, about the surgery room. How do
Yes.
you help during surgery? Are you handling equipment? Are you passing equipment? Like, what does that process look like for the dental assistant?
Sure. So here at the Folic Center, right now, I'm just doing new patients and postoperative exams. But 10 years ago, I was a lead assistant at a surgery clinic, and I was working with a local oral surgeon in the area. And my day started at 6:30 while I would get there and make sure that my OR or surgery room was prepared. It was a sterile setting, so everything had to be set up with gloves on. I had to spike my IV bags, make sure that when my patient got there, make sure that they were in the chair, make sure that they're properly draped. All my equipment are spread out on the table, have surgical gloves on, doing all of this. Very sterile setting. My doctor would come in, I would put his gloves on, don his don his gown, tie him up, and then we'll start our surgery. Was very detailed, very detailed. There's a lot of instrumentation. There's a lot to remember, a lot of small parts, a lot to keep track of, and of course, the equipment to maintain. Throughout the day, taking the rooms down, making sure that my patients were in recovery, having other team members to come in and assist because it is rather, some of the procedures and processes are very big. So it's a lot to be responsible for. Having a good team to come in and to work with you and breaking down the products, breaking down the IV bags, making sure that the patient comes out of the anesthesia correctly, making sure that they're not having any negative responses, and making sure that we're passing them off to their loved ones with good post-op care, good post-op packaging. They understand what to do and what to do in the case of emergency, and all of that was part of my day, as part of my day. I enjoyed working in surgery. I did that for about 1.5 years in that particular specialty, and we did implants, bone graft, orthodontic surgery. We did some of the procedures over in hospital setting as
Wow.
well. So yeah, we had that
Thank you.
experience as well. Sure.
Thank you so much for that. I want to wrap up. I'm going to ask Cindy a final question. Before I do, I'm just curious because we have a lot of school, like teachers watching through the projector. Teachers, can you tell me just how many students are with you in the classroom? We never have a full grasp of how many are watching with us live because we just have the one person. If you could tell us in the chat how many students are with you, that's just helpful information for us to know for future. Cindy, you said that all your time as dental assisting, you loved it. You just loved the job. What was it that brought you joy? Let's wrap up on that. What brought you joy about the job, and how would you then suggest or encourage others to do the same?
For me, it was providing good care and providing the patients with confidence. And I think, to me, smiles are very important. They are, they make your face light up. And having a patient with a good experience, they're understanding that their teeth are as important as any other part of their body, and giving them the confidence that they can use their smile and use it often. I just think smiles are so important, and it was important to me. I did want to mention, Danny, that one of the things that we at HOSA do is, even if you're not in a dental classroom, you can experience some of those things by looking at the different dental competitions. Perhaps you're in an overall general course, and you can experience doing research in those areas and even compete. But again, I loved it. I loved being in a dental office. I loved working with the patients, providing them with good information so that they could provide that to their family, and we could bring a smile to their face.
Thank you so much for that. I want to thank Cindy, Sherry, and Sarah, who had technical problems while she was here. Thank you to her for being here and answering all the great questions from teachers and students. And I had a feeling with a lot of students here. For future webinars, please, students, keep the chat focused on our topic of conversation so that everybody can learn and make the most from our special guests. Speaking of which, we will talk to a CPA, 2 CPAs, talking about the world of accounting on November 13th. So that'll be our next dream job session. Then a construction manager, a graphic designer, lots of interesting people still to come in our fall series. Thank you, Cindy, Sherry, Andrea, for your time today. And again, this will be on YouTube soon and on our YouTube channel. We appreciate you all being here. Great crowd today, one of our best. And I hope the students got a lot out of the conversation. And again, the teachers, you can find the link one more time in the chat for our email etiquette tool. Please request it, and we will make sure you have it. I hope everybody has a great rest of their Wednesday, and we will see you in November. Thanks again.